Okay.
Hi, I'm Jackie.
Hi, I'm Victoria.
Victoria is my daughter, and together we decided to open and operate a small local business during the unexpected global pandemic, COVID-19. Our small business located in Atlantic City area is an ice cream store called the Island Creamery, New Jersey, that opened early spring of this year.
You see, this wouldn't have been as hard if it wasn't for the fact that both my mom and I are also full-time healthcare workers. Once COVID-19 became a serious problem, our roles as healthcare providers grew to a whole new level. We're here today to talk to you about how we kind of balanced both roles during this unprecedented time.
I am a specialized healthcare practitioner trained in respiratory therapy and have been for the past 15 years. Respiratory therapy is a branch of medicine that entails critical care and cardiopulmonary medicine. A lot of my day-to-day tasks as a respiratory therapist include examining patients with breathing or cardiopulmonary difficulties, consulting physicians to develop plans of cares, perform diagnostic testing, treat patients, monitor their symptoms, educate them, and prepare them to go home with their disease.
So I am also in the healthcare field. I'm a licensed emergency medical technician. I am trained to medically assess and treat patients, basically in hospital and pre-hospital setting. I have had my certification for approximately 4.5 years now, and I've been working in the medical field since 2016. Recently, I took on a job as a emergency department technician as of last August, which has allowed me to apply my skills to in-hospital setting. And a lot of my roles in that field include performing diagnostic tests and overall helping out the physicians, the nurses, and the physician assistants with any tasks that they need executed down in the emergency department.
Island Creamery was not my first small owned business and was inspired by my first business that I owned. When I first began as a respiratory therapist, I had already been a small business owner for approximately 16 years with my first ice cream store. After selling my first ice cream shop to pursue my career in medicine full time, I knew it was only a matter of time before I would want to open up another small business again.
Growing up as an only child, I spent a lot of time with my mom at her first ice cream shop. So when my mom brought up the idea of opening up another last year, I was really excited about the opportunity to be able to help my mom out with the idea. So together we designed a store basically from the ground up. This basically included us doing the interior design, a whole menu with specialized products, a logo, and other products that made Island Creamery kind of one of a kind. The construction portion of it took some serious time in prepping for opening, and it also took a lot of time because of the details having to be worked out.
When this idea for Island Creamery took flight, we never expected it to take place during COVID-19 breakout. The COVID-19 heavily impacted the business and the time we were able to dedicate to the business simply because our demands at the hospital grew rapidly.
With that being said, when we first opened, we hardly had any customers at all. People were cautious about leaving their homes to be out in the public, and the business suffered greatly because of it. Between the construction delays, the statewide shutdown, and taking precautions, the business was basically being taken day to day.
I watched as multiple family-owned businesses in the neighborhood around us slowly boarded up their windows and shut down for good. Some small business owners around us talked about how it would be their last season for good, and I couldn't help but think we would make it. How we would make it being our first summer, our first season, if these businesses that have been open for years couldn't make it. I'd be lying if I said that the panic didn't set in. I started to worry that opening the business had been a huge mistake and that we wouldn't make it through the first season. How were we going to make it through the next?
It also didn't help that both of us were trying to operate the business and balance our 12-hour shifts at the hospital. With the business not taking off the way we hoped and seeing just how devastating the pandemic was for people coming into the hospital, our stress levels were at an ultimate high.
It was also difficult to be in the hospital and be exposed to the virus right from the start and not fully knowing the extent of which COVID-19 could impact someone. In the hospital, I witnessed a lot of hysteria and shortage of personal protective equipment. A lot of my coworkers stopped coming to work in fear of taking it home to their families, which left me afraid to bring it home or even to take it to the store.
We didn't know much about COVID-19 when it first became prevalent, and it was almost like running into a burning building with no knowledge of how to protect ourselves and save others at the same time. It was concerning for me, especially because I was spending all of my time basically around a lot of sick people, and I have a compromised respiratory system, being that I have really severe asthma. This basically heightened my fear of what was to come in the following months.
There were multiple weeks throughout the following months where we would have to close the doors for a couple days at a time to ensure that we were not bringing anything home with us that could potentially affect our customers.
As time went on, though, we were able to hire some extra staff that really helped out along the way, and we were able to keep the shop up and running on the days that my mom and I couldn't be there personally.
Our primary concern for everyone was safety. Though the business had an extremely slow first season, it was important to ensure that we were following the safety guidelines of capacity and other regulations. When we first opened, the state ended up shutting down, which put us at a complete halt.
As time went on, though, we found that as the virus progressed, the curve of the cases began to decrease. This allowed for us to finally open the doors fully for the business and for customers to come in and experience what shop and what we had to offer, which allowed for us to realize that we were seeing a lot of new faces we didn't see when we first opened.
Though the pandemic threw some unexpected obstacles at us, we were able to successfully make it through our first season being open and anticipate being open for another season next spring.
We know that the pandemic won't be going away anytime soon, so when the time comes for us to open during our next season, we'll be ready to adapt in any way necessary to ensure the safety and of our staff and customers.
This past year has been difficult yet rewarding year for us and for small businesses, with the challenges followed by learning to overcome and adapt to keeping the business open for another day.
Thank you everyone so much for watching. I hope you stay safe.
Stay safe.